Good morning to all. Welcome to the International Surgical Wound Complications Advisory Panel and Asean Hybrid Conference. I also would like to congratulate Professor Harikrishnan Nair and his team for this wonderful occasion, where all experts around the globe gather and share their best practice experience, even that we are in the pandemic right now. Thank you for giving me the chance to take part and to be one of the invited speakers. My topic for this session is about ERAS, Enhanced Recovery After Surgery. And I was told to mention some of the things or dressings used during the patient's experience and patient's journey on this program. These are my common disclosures. The contents presented in my slides and on these lectures are my opinions only and does not represent or reflect any opinion of the institution where I am now. They are for scientific discussions only and are not for recommended off-label recommendations. Contents of the lectures are based on current best practices, guidelines, and protocols and ERAS implementation done in our institution, and most of them also are from the published studies. Now, according to the American Association of Nurse Anesthetists, ERAS is a patient-centered, multidisciplinary team that have been developed different pathways for a surgical specialty and facility culture to reduce patients' surgical stress response, optimize their physiologic function, and facilitate early recovery. These care pathways form an integrated continuum as the patient moves from home to the pre-hospital, pre-admission, preoperative, intraoperative, and postoperative phases of surgery. Now, the Enhanced Recovery After Surgery, or ERAS, is a case model introduced in 1997 by a group of surgeons from Europe led by Dr. Henrik Kelle. Their main goal is to produce improvements in surgical outcomes, especially in reducing the hospital length of stay, complication rate, reduction of economic burdens, and of course, early recovery for patients. Ever since our institution have started the program, we have been obtaining better outcomes and a more optimized process. Now, because of the ERAS and because of its popularity, most of the surgeons and anesthesiologists in our institution have decided to create and start our own ERAS program. The medical city has been officially recognized as a center of excellence for ERAS in the Philippines and also in the Southeast Asian region. Now, when we are starting to do this, we also focus on the involvement of not only the patient, but also their relatives as active participants. And this is for their own recovery and care also. Presently, we started to form a colorectal program, which is connected to the ERAS program, customly designed for patients who will undergo abdominal surgeries and patients who will have a stoma creation in the future. Now, basically, our program consists of 4 important elements, which includes preoperative assessment, planning and surgical preparation, intra and post-operative phase, and lastly, early mobilization of the patient, and then from the patient's admission to discharge and also to continuity of care. ERAS represented a paradigm shift in perioperative care and re-examining traditional practices being done even up to now and replacing them with a more evidence-based practice and scientific-based. It is also a very comprehensive into scope covering almost all of the patient's journey, including the surgical process. Now, there are important key elements when it comes to providing an ERAS program. And these key elements include, of course, number one, patient and family education. The preoperative phase, there is minimal fasting, multimodal analgesia is included, early nutrition and mobilization after the surgery, postoperative counseling and re-evaluation of patients prior to discharge. And very important is to identify the patient's independence. Since this is a colorectal ERAS program, so if the patient has a stomach created, it is important for us to identify if the patient is independent enough to take care of himself, especially when they go home or when they are being discharged. And it is also important to emphasize patient follow-up and continuity of care. Now, with regards to the re-evaluation, and we have seen that the patient is not yet ready and the family also is not yet ready when it comes to supporting the patient, then there will be a time wherein we must refer the patient to continuity of care, or we must extend the care from the hospital to the patients. Now, the patient pathway that was created has an inclusion and exclusion criteria. And of course, this is to identify to which patient is amenable or will qualify for the ERAS program. Inclusion criteria includes, of course, it must be an elective colorectal surgery, a major elective colorectal surgery. The patient must be 18 years old and above and must be medically cleared for surgery. Exclusion criteria includes non-major abdominal surgery, emergency abdominal surgery, and of course, if there is a significant comorbidity or comorbid to the case of the patient. So, pertaining to the patient pathway or to the ERAS pathway, the ERAS nurse does the initial assessment and the activation of the patient pathway. So she does the interviews, filling up the checklist, coordinating to the other departments. So the role of the ERAS nurse is very important. And presently, we only have a few of them in the institution. Now, the ERAS nurse must also ensure that the necessary laboratory and diagnostic tests are done in accordance to the patient's pathway. And if not possible, we'll tag it as a variance. And then we'll identify if there's a need to have other assessment tests done or diagnostic tests done to the patient. Referral to various specialties like the cardiology department, nutrition, anesthesia, to our department, which is the stoma and department. It's very essential. It may also include pulmonologists and endocrinologists, which is included on the patient's path. Now, some referrals, which is not included in the pathway, is also possible, but that might be depending on the assessment of the ERAS nurse and also with the consultant. And lastly, after all of the procedures are done, preoperative, intra-op, post-operatively, we always emphasize continuity of care. Now, for patients who will undergo stoma surgery, which was generally created for our ERAS program, and since it was created by colorectal department and colorectal surgeons on board, we focus on the stoma surgery or patients who will undergo abdominal surgery. Now, there are mainly three phases that must be accomplished during this program. First is the preoperative phase, which consists of course, ostomy marking, preoperative counseling, care planning, and discharge planning. Postoperative phase includes pouching techniques, product orientation, ostomy care, complication management. These are only the basic complications that might happen in the future for patients who will have a stomach creation. And again, there is continuity of care, which includes, again, post-operative patient and family counseling, what they're going to do at home, how to take care, what they're going to do when they travel. Of course, identifying different access to care. If the patient is living too far from the institution or to the hospital, we also have different support groups that can help the patient and the family member. Now, During the preoperative phase, the patient and relatives are referred to the stoma and wound center. This is basically 2 to 3 days prior to the surgery, or when will the patient and the family members be available. It is very important that the patient has a family member with him or with her when they go for the initial phase or the preoperative phase. Now, this is to prepare and orient the patient and the family to the whole ERAS program, what they're going to do, what they're going to expect, and informing them also who's going to be in charge while they are in the hospital or while they are enrolled to the program. This also includes the creation of a site marking or stoma planning for the patient. For the patient's family, this would also include the basic introduction about the stoma, orienting them about what is a stoma, and of course, showing them different available appliances that they're going to use, and who are they going to contact when they're at home or just in case there's an emergency. We also focus more and give attention to details, especially to the patient and family's questions and inquiries. And this is where we give them much more time to boost the patient's confidence, of course, and of course to lessen their anxiety and stress pertaining to the procedure that the patient will undergo. Now, the ERAS nurse has to identify the patient's normal activities of daily living or normal health. This is prior to the surgery. And the patient's pre-operative activities and daily living, which includes the following. These are the common questions that the ERAS nurse will ask or identify if the patient is able to get out of the bed, is the patient to do personal hygiene, is the patient able to go to the toilet unassisted, or they may need assistance. Can the patient tolerate the food served by the dietary based on the nutritional regimen, or the patient prefers something in addition to their nutrition? And this is very important to also identify the patient's dependency after the surgery and also before they go home. Now, when it comes to the post-operative phase, this is the time where we educate the patient and the relatives about the different stoma pouches, appliance, how to drain the pouches, how to change it when there is leakage. But first, we have to identify the patient's willingness to learn so that it will be effective, and the time consumed is maximized. We also tell the patient and relatives where to buy the different products. When they travel, they also have to know where the nearest store that has ostomy products is, so they won't be having any problems. And because there are still some difficulty in obtaining these products on some parts of the country, and there are some stores or hospitals that doesn't have an ostomy and wound center as of the moment here in the Philippines. This is also the place where we educate them on handling different situations and managing simple complications that might happen to them in the future. So this may include, of course, basic skin irritations, minor leakage, and of course, some issues pertaining to diarrhea, constipation, and if there's a need for them to be educated more on the diet, it is also included on the ERAS program that the patient must be referred to a nutritionist. So it's included preoperative and postoperatively. And of course, when they are being discharged, diet regimen is given to the patient, and regular counseling is done by the dietitian or the nutritionist of the patient. Now, this is their basic patient process flow, wherein after the patient's operation, generally a ostomy nurse 24 and 48 hours after the surgery visits the patient. But again, this is not mainly this is just to talk to the patient and to have a regular conversation so that the patient will feel comfortable to the ostomy nurse or to the ERAS nurse, and so that they can gain the trust of the patient, and also so that the patient will be able to verbalize more with regards to their concern to their nurse. And the nurse, therefore, or the ARAS nurse, assesses and evaluates the patient's family independency and also includes the coping of the family pertaining to the procedure and to the patient itself. Now, we also evaluate if the patient needs for if ever in the future, may need a continuity of care program. So if there is a need for continuity of care program, we assigned a home care nurse or a continuity of care nurse who's going to visit the patient from time to time. And this nurse would also have to reevaluate and reassess the patient's independency and also will check with regards to the patient's condition and the family support to the patient when they're already. Now, these are the basic facings and appliances that we use and may be in use for with the patient after the surgery or maybe before the surgery. So basically, just consists of the basic transparent films. So it's used for covering the surgical wounds, and then skin barriers, stoma pouches, adhesives, stoma accessories, education materials, which is very important. So we provide brochures and ostomy kit bag. It's a kit bag wherein everything that they need is included on that kit bag. So wherever they go, it's easy for them to identify the things that they need in the future. Hydrocolloids for basic irritations that may happen, and also to manage some minor complications, skin irritations. Cleansing and irrigating solutions is also important. Now, um, because of the pandemic that has happened, we tend to make a application so that the patients can have easy access to the hospital and to the center. So the app includes also the different services that the center may offer to them, and also it also includes the hotline or persons that they need to contact. If they need an appointment to the center, it is easy to look at the app, check out the app, and then make an appointment there. And it's downloadable and it is free for the patients use. And not only for the center, but also to other diagnostic centers, the institution, it is included on that app. Now, when it comes to home instructions, it is very important to give health educations on how to reinforce or change dressings at home. Also, especially those who are living far from the hospital. So most of the time we give them extra dressings or extra appliances so that just in case they run out at home and there's no available store where they can buy their appliances, they can have an ample time of buying or going to the hospital. And then ensure that the relatives are also capable of doing it at home, just in case that the patient is not that independent enough and still needs the support of the relative. So we always include the patient's relative when it comes to educating them on how to take care of their stomach. We also use dressings that are widely available so that patients can have easy access. Do not give appliances or dressings that are very rare or hard to find, because later on the patient and the relatives will be having a hard time on looking for those appliances that you have suggested. So patients are also contacted when they are at home to check on them from time to time. And again, to identify the level of independency of the patient. Now, just in case that the patient also has a scheduled visit at the center and then the patient did not make it, it is the role of the ostomy nurse or the nurse provider, healthcare provider to call the patient's home to know if there's something wrong or what has happened to the patient and the reason why they did not make it to their follow-up. This is also to check and to also take note of the patient's compliance when it comes to their treatment. Now, when it comes to continuity of care, we were able to identify different methods that will be much more convenient and comfortable for the patient This includes also teleconsultation service. And again, this is because of due to the pandemic. We were able to create a server or a service wherein with the downloaded app, they can easily get appointments. They can talk to to their doctors or healthcare providers if they have any questions. There is also we have also made instructional videos, different instructional videos for them on how to take care of their problems when they're at home. And just in case that there's really a need or an urgency, we can provide medical home services for them. So it includes laboratory services, stomach care, wound care, on their convenience. So because nowadays they're afraid of going to the hospital, so we have provided these services for them. Now, an ostomy support group or support group is also included to their care. And there are also different support groups that is available in the Philippines. And before the pandemic, we do regular lay forums and activities pertaining to them. But as of the moment, because of the pandemic, these activities and gatherings of the different organizations is not allowed as of the moment. So from time to time, we just use their groups, Viber groups or Facebook or WhatsApp, and have regular meetings as well. Now, what are the future plans? Basically, this is to promote and to have ERAS to other surgical cases as well. So because now we just have this done to a colorectal level, no, and this is also to increase the awareness of the other healthcare workers, even to other institutions, that ERAS is a very good program, and we also needed more trainings and certifications for nurses, and not only nurses but also other healthcare providers when it comes to the ERAS specialty, and that this can be a specialty and specialization in the future for them. And also to collaborate to other countries who is also doing ERAS programs, because as of the moment, in my knowledge, there are only few countries who are doing ERAS program. As far as I remember, this has been spearheaded and piloted in our hospital by our colorectal surgeon, Dr. Rami Rojas. And initially, it has found out, or it has made many good results pertaining to the patient's welfare, and specifically to longer length of stay, and also by eliminating traditional practices at the hospital. And some of them have made great improvements and are much more appreciated by the different specialties also. Now, working together is, I think, is the key on everything, and especially on new ideas. And when we started creating this ERAS program, there is really only a few people who has been involved, but now it has been greatly influenced by the institution and by good and with good support of our administration, with the top management, and also with a good marketing strategy. We were able to promote this well on our patient, not only by the patient but also to other healthcare workers. And the ERAS Society that the institution has started, and also other hospitals, has been greatly influencing other hospitals and institutions nationwide. And hopefully in the future, that to have an ERAS program and also an ERAS Society would come up with a much more larger venue, and more people will be interested and will be joining. And I think that would be my last slide, and I hope that I have shared some of our best experiences and best practices. Terima kasih. Maraming salamat.